ago.
In a one-on-one Zoom interview with Michigan's Chief Medical Executive, Dr. Jonae S. Khaldun.
Thank you for having me.
Her message for all Michiganders is clear. Wear a mask and vaccinate. Here's why.
We don't have very much in the toolbox when it comes to fighting COVID-19. You know this, there's no vaccine, there's no antiviral. So it's the social distancing, prevention of spread that we really have to do.
Here's a graphic from the Michigan Department of Health and Human Services that shows how masks work. According to Dr. Khaldun, whether we choose to wear our masks today will determine that potential second wave we've heard so much about.
As we've slowly dialed up and reopened the economy and people are interacting more, we did expect for there to be more and more cases, but we can still limit and slow the spread of the disease. We can limit the number of people who have to be in the hospital, and we can get to the point where there is a vaccine and we can get people immunized so that we can, again, prevent these surges like we've seen in the past spring.
Younger generations are where we're seeing a lot of uptick in cases right now. So how do you feel about schools having students return in the fall?
You know, it's something I'm very concerned about. I know, again, how important education is, and I want more than ever for our kids to be back in school in person in the fall. But we have to do it safely. And that's why, to be honest, the things we do right now and over the next 8 weeks so that the spread of the disease is as slow and limited as possible, that's how we're going to be able to get our kids and our college students back in school in the fall.
No matter where students are learning, Dr. Khaldun says there is one thing your child and yourself will need this year.
When the flu shot is available, to please get your flu shot as well. We know that there will be both flu and COVID circulating in our communities in the fall. And it's going to be so important that everyone 6 months and older who's able to get the flu vaccine gets it. That will contribute to overwhelming our hospitals as well if we have people who are in the hospital because of flu and COVID.
Even if you still get the flu, Dr. Khaldun says the vaccine keeps the virus from being as severe as it could be. And speaking of vaccines, I asked Dr. Khaldun her thoughts on a potential coronavirus one.
I certainly hope we get a vaccine as quickly as possible. I don't expect it before, at the earliest late fall. But what's probably going to end up happening is there will be a limited supply of vaccine that's allocated to every state from the CDC, and they will prioritize different populations based on their risk. And very likely it will end up being for healthcare providers, frontline healthcare workers first, and then they may recommend that we make sure the vaccine is available to vulnerable populations, whether that be the elderly or minority, people of color, minority population.
If no one receives the vaccine or adheres to guidelines as they come out, how do you see things faring in the next year or even two?
I know people are anxious and they don't want to be the guinea pigs. I've heard a lot of people talk about that. And I understand there is a valid, sometimes mistrust of the medical community. Our country has a history of experimenting on some folks. And I understand why there's some anxiety and mistrust, but we have to, I think, get beyond that and make sure, of course, as long as the vaccine is safe, that people are getting access to it.